Hey everybody, it's Dr. Wilson. I'm outside today doing this quick little video for you because vitamin D is what we're going to talk about. Now, when we get exposure to sunlight, of course, our bodies are going to produce vitamin D, which is the best way to get it. However, we don't want to overexpose our skin to the sun, right? And the radiation effects, skin cancers, all these things. But I wanted to talk about vitamin D. We do blood tests in the office to test where people's vitamin Ds are at. It's important. We need vitamin D in our body for a lot of different things. Hundreds of different genetic processes rely on vitamin D being present. Another thing with spine and bones all the time that we're helping people with, our bone health relies on us having enough vitamin D. So if we want to have thick, good bone mineralization, we need vitamin D present. It helps drive the calcium. But also, on a side note, I get a lot of patients that will be taking vitamin D from just a box store. They'll just pick up a real cheap one somewhere. The quality of the vitamin D makes a difference. If it's not the right form, then it's going to drive calcium into the bloodstream, and that's not a good thing. We need calcium in the blood, but not too much. If it elevates, it starts to actually tear down bone mineralization and weaken our bones. It also affects our heart and our brain and amongst other things. So it's important that we don't just flood the bloodstream with calcium by taking a crappy vitamin D. So make sure whatever you're taking is a good one. It's got to be the right form, and also coupled with K. So that's the stuff that you want to watch out for. It's also important that you know where your vitamin D levels are at. So doing at least an annual test for most people is wise and prudent to know where it's at and what you need to be doing differently to make sure that that level stays up in a healthy range. So if you need help getting your vitamin D checked, and you're a member of the practice, of course, just let me know, or anybody on the team, and we can schedule time to get the blood work done for that. If you're getting routine blood work done somewhere else, at maybe your primary care physician or your medical doctor or something, let me know what the numbers are so that I can also be helping to guide you in the right track. So have a blessed day and keep your vitamin D in check.